So from the start of the pandemic, COVID-19 widened an already existing divide among Americans. Now the Omicron variant appears to have sent our understanding of the virus into a tailspin. A recent article in The Atlantic examines just how the highly contagious strain with much milder symptoms is causing some confusion, and it spawned a new rift, this time among the fully vaccinated. So we want to bring in the author of that piece, Derek Thompson. Derek, thanks for joining us. It was a really interesting concept to think about because I see this happening in my own life, and I'm sure, Vlad, you do too. We all know people who are triple vaxxed, their kids are vaxxed, and they're ready to go out and eat at a restaurant. And then there are other people that say, "Are you nuts? Who could eat at a restaurant?" When cases are surging. So you write how the Omicron variant has sort of muddled people's views of the pandemic, making some 2022 Democrats sound a lot like 2020 Republicans who were sort of naysayers when it came to the virus. Explain what you mean and how we got here.
Sure. I think the big debate, the big schism of 2021 was vax or no vax. Do you accept the vaccines or do you deny that the vaccines work? You say you're not going to take them. That was the debate for 2021. The debate for early 2022 that I see emerging within the vaccinated community, right? These are people who already said, give me the first shot, give me the second shot, often give me the third booster, is am I vaxxed and done or am I vaxxed and still cautious? And I try to give a good faith reading of both of these groups. Among people who say they're vaxxed and done, they're basically saying, look, I masked, I canceled vacations, I didn't go to weddings, I didn't go to funerals, I put my life on pause, I did everything the public health authorities told me to do. And now this virus presents very little risk of severe illness, hospitalization, and death to me. So I don't believe that I should continue to live in emergency conditions in this pandemic. That's group number one. Then you have group number two that's saying, we are individuals who might feel safe, but we live within a network of individuals who might not themselves be safe. There are people who are elderly in their 80s and 90s for whom this virus is considerably more dangerous. There's immunocompromised people that are in my life or in the networks around my life. And for them, I am willing to continue to live with unusual precautions in my life. And I really see this schism, this tension between the vaxxed and done and the vaxxed and cautious as being a really important schism within the Democratic Party among liberals. And that's why I wanted to put my finger on it and say, these groups are emerging. Let's talk about their positions, where they disagree, and how we might be able to build bridges between them.
Yeah, and I found your article absolutely fascinating. A bunch of my friends and colleagues were sharing it when it first came out, Derek. I mean, all of your pieces for The Atlantic are always highly, highly shareable. I encourage our viewers to check out your work. But that's why we wanted to talk to you, because you also point out that there are benefits and dangers to both sides. Folks want to keep schools open, but on the other hand, don't want to overload healthcare workers. Explain those two arguments and how people relate to them.
Sure. I think the vaxxed and done movement is saying, let's apply our ideology to schools. We are still shutting down schools when there are a few cases, even in cases where the students are vaccinated. We are giving teachers the ability to not keep schools open, thereby outsourcing daycare to parents who can't go to work. So we're on emergency footing when it comes to U.S. education, but the fact that we're on emergency footing is keeping families who are basically safe from continuing to move on with their normal lives. And that's not fair. Not only is it not fair, it's not sustainable. If we have an understanding that this virus is entering a somewhat endemic phase, where there will always be breakthroughs, there will always be cases, but the vaccines wrestle those cases down to the point where they're more like the flu or the cold, which are risks that we have lived with without changing our lives for decades, hundreds of years, well, then we can't continue to live in an emergency world where we're canceling schools left and right. That's the vax and done argument. But then you still have the vax and cautious argument that says, look at hospitalizations, they're at record highs. Look at the burden that are continuing to live semi-normal lives is putting on the healthcare system. We need to, at least through this Omicron wave, change our behaviors significantly in order to keep those burdens from just absolutely inundating hospitals and making people sick and causing unnecessary deaths and suffering there. That's the argument that I see. And you can make a synthesis case that says, let's keep schools open. Number one, let's really, really try to have a default of keeping schools open. But let's also encourage people for the next few weeks to pull back their public activities just a little bit as this hyperspeed Omicron wave works its way through the population. Because one more detail, and then I'll throw it back to you. Omicron is much faster than Delta. It seems from the Gauteng, South Africa data, from the London data, from what we're already seeing in Boston, New York, Chicago, to be moving through the population about 3 times faster than a typical COVID wave, which means maybe we just pull in, we just gird up for a really short period of time, and then we announce February, I'm vaxxed and done.
Okay, so come February, let's keep this, going. Is it then we're completely back to normal? Is it then we treat Omicron like we treat the flu? And the way we treat the flu is if somebody you had a coffee with calls you the next day and says, oh man, I feel like I got the flu, you go, oh, that's too bad. Do you want me to bring some soup over for you? You never think, oh my God, I should test. Oh my God, I should isolate. You never think that. You go, well, I'm sorry for you. I didn't get the flu. So is that what we should just sort of ease into? Is that what you're saying?
I think that in a future that does not currently exist, right? So everything that I've said so far is trying to do my best to give a good faith summary of 2 arguments I see emerging, right? And now you're saying, okay, Derek, I'm not going to let you off the hook. You have to tell me what you think we should do, not just summarize other people's opinion. I totally respect that. In a world where cases are not 700,000 a day, 1.4 million a day, but are rather in the low tens of thousands a day, in a highly vaccinated community, where we see that hospitalizations are low and deaths are low and declining in terms of COVID, I do think that it will be time to treat this respiratory virus the same way that we treat other respiratory viruses. At some point, if the risk to individuals in your network of COVID is no different than the risk of previous flus or colds in terms of severe illness and death, we cannot have an indefinite, permanent policy of treating endemic COVID in a way that is vastly different than the way that we've historically treated the influenza virus. I think that we should be prepared to have a transition moment, to have what some people call an off-ramp from emergency conditions to sort of normal long-term treatment of this disease. I do believe that we should off-ramp. If your question to me is, when should we off-ramp? My answer is probably not on the exact same day that we recorded the highest number of cases ever. Probably not at the moment that hospitalizations are the highest they've ever been. Probably not at the moment that ICU patients are still increasing in most major metro areas. Probably not now, but soon.
So, Derek, what I also find really, really interesting, and perhaps a byproduct of this pandemic, if we are going to talk about COVID-19 as if it's the flu in the future, not today, but in the future, that we adopt some of the measures that, for example, I lived and worked in Japan for some time. When people are sick, if they have a cold, they wear a mask. They wear a mask to protect the people around them on the metros, on the buses, on the underground, wherever they happen to be, so that they don't infect somebody else with whatever it is they have, whether it's the flu or just a common cold. Washing hands is still a very, very big deal in Asia because of SARS back in the day. That might be a wonderful aspect of what has been a very terrible period for millions of Americans and millions of people around the world. But the interesting part of your article is the politicization around COVID-19, because you point out that in 2020, it was Republicans led by President Donald Trump, then President Donald Trump, who insisted that COVID was barely anything worse than the flu, that its fatality risk was comparable to an everyday activity like driving a car. Now that we're in the current Omicron wave, Republican talking points became true for Democrats. And that is the problem with having this pandemic or viewing this pandemic through the frame of politics. Because in a world where we could wear a mask to protect ourselves, you wouldn't get somebody saying, why are you wearing a mask? Why are you wearing a mask? You must be a Democrat. You must live in a blue state. It would just be because I'm doing it to keep people safe.
And Vlad, just to jump in, perhaps the ultimate irony is now, sorry, Derek, perhaps the ultimate irony is that now we're also hearing from the former President Trump chastising other Republicans for not admitting to getting a booster shot and actually encouraging people to get a booster shot. Everything has just turned all around. Sorry, go ahead, Derek.
Yeah, it's extremely confusing. Former President Trump's messaging on this has been an absolute disaster. I have stronger words for what I think it is, but I don't think that they're appropriate for CBSN. I agree strongly with two things that you just said. Number one, we don't have to just treat endemic COVID the exact same way that we treated, say, 2011 seasonal flus. We now understand that N95 masks are I think, fairly effective, even when only one person is wearing them, in terms of limiting the spread of a respiratory virus. So I would encourage people in this future that we're discussing, right? We're not discussing January 2022, we're discussing the future. I would encourage people to continue to keep masks as a part of their arsenal. I don't think they should necessarily be, mandated in a world of endemic COVID, but I think they're an important part of this arsenal. Right here, coming up on the screen, you have antigen home tests. I would love to see home tests becoming a part of the arsenal as well. If you think that you've got COVID, test, and maybe pull yourself out of commission for the next day, for the next few days in this sort of endemic COVID world, so that you aren't spreading it further. I think there are ways to use testing and mitigation infrastructure to keep ourselves safer in this future, and the choices aren't live in a world where you're basically a hermit and you order everything to visit you in your living room and you never see people, versus ollie oxen free, let's just run outside and start, never testing and never using any of this infrastructure again. So I like that you brought in the infrastructure element. I think that's important. The second thing that you said, which is just impossible to remedy because it's just the life that the reality that we swim in, is that this issue is highly politicized. I was looking at some polling data in terms of the percent of middle-aged men, Democrats versus Republicans, who say that they got vaccinated. For Democrats, 2% say they did not get vaccinated. For Republicans, middle-aged men, 47% say they did not and will not get vaccinated. I don't know how to solve this problem. And the truth is that I will never solve the problem, right? Because all the people who basically agree with me about this virus have already gotten vaccinated. All the people who disagree with me about this virus are saying, or not all of them, half of them are saying they're never going to get vaccinated. We need the president, we need other Republican leaders to stand up and shout loudly as possible, the Tucker Carlsons of the world, these vaccines are safe and they decrease by an order of magnitude your odds of developing severe illness or death from this disease. A lot of them are not going to do it. The scenario that I just painted for you, where Tucker Carlson screams this from the rooftops, that is a fantasy. It's not going to happen this year, unfortunately. And so I don't know what the remedy of that is. And I'm afraid of, last point here, I'm afraid of Americans saying we can't get back to normal until more than half of Republican 30-something men get vaccinated, because that just might be a world that never materializes. We have to find an off-ramp from emergency circumstances that deal with reality and not fantasy.
So, Derek, I know we got to run, but Anne-Marie, just to the point that you made, if former President Donald Trump is taking to the airwaves, and he has in recent weeks, going back to December, I mean, in an interview he just gave this week, he called politicians who refused to reveal their vaccination status gutless, saying that he's been not only vaccinated, he's received the booster, and he thinks that people should also get it. I wonder if that might be enough to get people to, those Republicans that you mentioned who are not vaccinated, to embrace the vaccine. Because I think this all started back, if you recall, when the former president was still on Twitter, for example, people who were wearing masks and the states that were locking down, he called for his supporters to liberate them, right? And now he's saying, and I think, he deserves credit for the vaccine ramp up that started under his administration, the warp speed that he engaged to bring those vaccines to the public. And I think he's sort of taking credit for that and saying, look, you should get vaccinated. Would that be a factor that might help?
I don't know. I hope so. I'm worried that we are in such a bizarre situation with negative polarization in America today that if liberals like me compliment President Trump for saying that people should be vaccinated, then Republicans, whose entire orientation of reality is to hate everything that liberals like me say, will feel more protected in criticizing the president denouncing his defense of vaccines. Like, we are in such a strange moment where liberals calling for a certain thing like vaccines makes conservatives less likely to accept the measure. I don't know how to solve this problem except to say that more conservative and Republican and right-wing luminaries like Tucker Carlson and Steve Bannon need to use their platforms on Fox News and whatever podcast to announce loudly that the vaccines are safe and that they do what they do. And what they do is reduce everyone, no matter what their age, everyone's risk of severe illness and death goes down by an order of magnitude, by 10x or more, between 10 and 20x. We see this in the hospitalization data in the CDC. We see it in the hospitalization data in Washington State. We see it in the hospitalization data in New York and New York City. It's the most obvious mathematical fact in the world, and yet it's not breaking through the wall of negative polarization in America. Unfortunately, I can't fix that problem, and no amount of indignation on my part is going to. So these are the facts, and I hope that in some way they trickle down into the consciousness of Republican America.
Derek Thompson, the piece that you wrote for The Atlantic is called "Why More Americans Are Saying They Are Vaxxed and Done." I encourage our viewers to check it out. It's really illuminating, and we love having you on. Thank you very much.
Great to be here. Thank you.